There are two main categories of hormone treatment available to provide relief from HGH deficiency. 1. Injectable bioidentical HGH therapy. 2. GHRH or growth hormone releasing hormone therapy with Sermorelin Acetate injections. There are many HGH brands that are utilized to provide growth hormone therapy to choose from, including Genotropin, Cyzen, Tevtropin, Nutropin, Humatrope, and Omnitrope. GHRH or growth hormone releasing hormone therapy is administered using two derivative recombinant hormone treatments, Sermorelin therapy and Tesamorelin therapy. Because these two medical treatments are virtually interchangeable, for the remainder of this video we will refer solely to Sermorelin acetate. Sermorelin does not come in a name brand. It is usually compounded at American pharmacies. Bioidentical growth hormone therapy works by directly supplementing the waning production of natural HGH by your own body. Post-puberty human growth hormone production peaks around the age range of our teens to the early 20s and starts to dwindle slowly over time. By one's 30s, HGH decline becomes apparent and people begin to start noticing some significant changes creeping up. Over the course of many years or decades, HGH levels in the blood drop to a point at which the natural hormone levels no longer meet the needs of the body. You might remember the first time in your 30s when you realized things don't seem to be healing as fast as they used to. With physician-monitored HGH therapy, our hormone specialist doctor will prescribe you a dose of injectable HGH designed to get your IGF-1 levels back to what would be considered normal for a man or woman in their late 20s and early-ish 30s. In doing so, it is possible to enhance cellular metabolism and provide all of the significant benefits of HGH replenishment and balance. And there are many benefits to growth hormone therapy that we will discuss in these videos and others on our HGH and Sermorelin research site. The goal of injectable Sermorelin acetate is the same as bioidentical human growth hormone: to boost HGH levels in the bloodstream to levels associated with early adulthood. It is the boost of HGH levels that stimulate the liver to increase its release of insulin-like growth factor 1, IGF-1. Sermorelin acetate shots do this by a different mechanism, however. Sermorelin is the functional and bioactive, meaning the working part, analog, or shortened version, of another hormone known as growth hormone releasing hormone, or GHRH. As you may be able to figure out just by looking at the name, you can likely figure out what GHRH does. It is an HGH secretagogue that stimulates the body to produce its own human growth hormone and, therefore, by proxy, increases IGF-1. To more fully understand how Sermorelin works, let's take a moment to reflect on the mechanisms which promote the release of HGH from the pituitary. It all starts at the hypothalamus, which is considered one of the command and control centers at the back seat of the brain. When the hypothalamus receives stimuli from the body, which indicates that HGH needs to be produced, it secretes GHRH in direct response. This GHRH flows from the hypothalamus to the pituitary gland via a route known as the hypophyseal portal system, a series of blood vessels which allow hormones to pass between these two regions or organs of the brain. HGH is released by cells known as somatotrophs, which are located in the anterior pituitary, front part of the pituitary. When GHRH activates these somatotroph cells, they respond directly by releasing growth hormone, which then flows through the bloodstream, either acting directly upon cells or indirectly via IGF-1 and other growth factors after being metabolized by the liver. Sermorelin works by essentially playing the role of GHRH, facilitating the production of human growth hormone release into the bloodstream. Sermorelin has the same impact on the body as GHRH, even though it is made up of a slightly different biological structure. GHRH is a long-chain polypeptide hormone made up of 41 to 44 individual amino acids. Researchers discovered that only the first 29 amino acids comprise the functional and therefore working component of GHRH. And by synthesizing a chain of the first 29 amino acids of this hormone, it is possible to influence HGH production in the exact same manner as GHRH. The 29 amino acid version is called Sermorelin. It is important to note here that there are two forms of HGH deficiency, which is a form of hypopituitarism: primary HGH and secondary HGH deficiency. Primary HGH deficiency refers to any medical condition which directly suppresses the functional ability of the pituitary to produce human growth hormone. Most often, this is the result of tumors, damage to the pituitary, surgery, genetic or congenital disabilities. Secondary HGH deficiency refers to any medical condition that causes the pituitary gland not to receive the proper signal to produce human growth hormone. There are many causes of secondary HGH deficiency, and many factors that can exacerbate the condition, including conditions which impact the function of the hypothalamus or thyroid gland, natural aging, sedentary lifestyle, obesity, drinking, smoking, poor sleep, anxiety. Sermorelin GHRH therapy is specifically designed to resolve secondary hypopituitarism and HGH deficiency. Patients with primary HGH deficiency will not produce sufficient human growth hormone to meet the needs of the body even when GHRH levels are normal, because no level of GHRH will effectively promote an unhealthy pituitary. Most of us have healthy pituitary glands that just need stimulation, and Sermorelin serves this purpose well. On the other hand, Sermorelin acetate is just as effective at treating human growth hormone deficiency in patients suffering from secondary hypopituitarism, because patients with secondary hypopituitarism have a perfectly healthy and functional pituitary gland. They don't receive enough GHRH signaling. In fact, age-related HGH deficiency is the most common form of adult-onset human growth hormone deficiency, and it is caused explicitly by declining GHRH release by the hypothalamus. That means that both Sermorelin and HGH can effectively treat this most common form of adult growth hormone deficiency. Our physicians tend to like Sermorelin over HGH because it works better with the body and is more affordable. In fact, there is substantial clinical evidence that for patients with secondary HGH deficiency, Sermorelin acetate can be the better choice for the treatment of growth hormone deficiency. There are a few reasons for this, and all of them are important. Sermorelin is less prone to an issue known as tachyphylaxis than with human growth hormone injections. Tachyphylaxis is a condition in which the brain recognizes abnormal patterns of hormones or medications within the body and adjusts its sensitivity to such hormone or medicines in response. In some cases, the body may develop a slight resistance to growth hormone injections over time. Sermorelin acetate injections, on the other hand, increases HGH within the body on its own schedule, and this reduces the risk of tachyphylaxis from occurring. This primarily benefits the wallet of the patient. For many patients, Sermorelin and HGH are not available via health insurance, so the cost of the treatment is significant. Sermorelin acetate is cheaper than human growth hormone and provides similar benefits, even potentially superior benefits. This drives many to turn to Sermorelin rather than bioidentical HGH. Because Sermorelin acts higher up in the hormone cascade than growth hormone or GH, the body has more mechanisms to control the function of Sermorelin and therefore can limit the production of human growth hormone if the hypothalamus receives sufficient signal. When human growth hormone is injected into the body, it is absorbed and put to use immediately, and there are a few mechanisms in place to limit the activity of HGH in the bloodstream once it is there, other than an immune response which can cause flu-like symptoms with HGH. That's not to say that human growth hormone therapy isn't safe when used appropriately. It means merely that Sermorelin reduces the risk of side effects associated with accidental overdose.